let's say a patient comes in and they have imaging in the ER and they have nodular and cavitary lesions in the upper lobes, you immediately should be thinking maybe malignancy or maybe tuberculosis. But you are an astute physician, you got bronchoscopy, bronchiolar lavage, and gram stains showed filamentous gram-positive rods that are weakly acid-fast. I hope you are now thinking nocardia. What we have here in this patient is pulmonary nocardiosis. It's the most common manifestation with patients with nocardia infection and if they are immunocompromised. That's the most important part of this lecture. This gram-positive rod is endemic in soil, and the disease is from spore inhalation, or you have traumatic inoculation into the skin. And you tend to really only see this in patients for immunocompromised or elderly patients. So don't forget to look at the question stem and look at the patient's age or see if they have a history of HIV. Step 2 loves testing this. Clinical features can even involve the brain, causing abscess, and cutaneous involvement as well. The treatment for this is TMP-SMX, and if you have an abscess, it's important to surgically drain it. Cultures take a really long time, and it's also important to do susceptibility testing because you want to test for all the isolate, and a lot of the strains for nocardia are already antibiotic resistant. If for some reason on the exam you can't find TMP-SMX, you probably would have the option of picking one antibiotic as well as amikacin, amikacin. This diagnosis, even though that you're treating them with several months of antibiotics, it's very common to have relapse of this infection. Now, why isn't this aspergillus? Well, aspergillus, yes, it can be in the upper lobe cavitary area and also seen in immunocompromised patients, but microscopy is going to show acid-fast negative hyphae. And remember that nocardia is weakly acid-fast. Now that we're in the topic of spores, what about Bacillus anthracis? Assuming that you did not get the gram stain, remember that people with anthracis also have fever, they have myalgias, they can get hypoxemic and even go into shock. Again, look at these prompts as a whole picture and pick nocardia if you have an immunocompromised host with pulmonary upper lobe disease and with a gram stain that is filamentous, gram-positive, weakly acid-fast. Remember to treat with TMP-SMX.